Good evening, Bermuda, and welcome to this very special panel presentation that we have for you tonight on the topic of mental health in Bermuda. Since the pandemic hit our shores and impacted all of us, we have likely discussed, or at least tapped into, our emotional and mental health well-being, now more than ever. In addition, another reminder about the crisis of human and social injustice in our world has hit us hard in recent days. So these challenging times often bring about feelings such as anger, frustration, pain, sadness, hopelessness, and others. Bermuda, we need to talk about this. Tonight's esteemed panelists are here from across the third, public, and private sectors of Bermuda. They will be speaking on the trends that they see in their areas of mental health in Bermuda. They will provide everyday coping tips that can help any one of us to cope better in our everyday life. And they will also talk about the red flags for when you need to reach out for more help other than what you may be doing on your own or in your own family and social circles. With that, I would like to welcome our panelists and tell you a little bit about what they're going to be speaking on. Tonight we have Rishee Paschal, a senior counselor at Family Center, who will be talking about child, adolescent, and family mental health. We have Dr. Gemma Harris, a senior clinical psychologist at Solstice, who will be talking about general adult mental health matters. We have Tawanna Wedderburn, the clinical director of mental health services at MWI, who will be talking about couples matters and carers of persons diagnosed with COVID-19. Followed by Dr. Cherita Rayner, a clinical psychologist at Mid-Atlantic Wellness Institute, who will be talking about persons with addictions and matters in that area. And finally, we have Aria Bean of EAP Bermuda, who will be talking about employer-employee relations during this time. So with that, I'm going to go to our first question for the panelists. So Rishee, can you please tell us about the mental health trends that you are seeing in child, adolescent, and family mental health in Bermuda?
Most definitely. Prior to COVID-19, our children are already dealing with various situations with school, with peers, with families. And amidst all of that, they're trying to find their way in identifying emotions, understanding their emotions, coping with them, and being able to manage their behaviors as it relates to the situations that they're in. On top of that, we have their parents who are also trying to manage themselves and their daily issues that they may face and challenges that may arise. And they're also trying to manage their children, manage their behaviors, understand their emotions. So in addition to that, now we have COVID-19, which has totally turned us all around and shifted us as a whole. Parents are now shifting in their work buildings and having to now be a parent and a teacher. Children are having to adjust from a structural setting of a brick and mortar going to school to now home being school. So that is also something that our parents are dealing with and our children are dealing with. And in addition to all these transitions and adjustments, there's also the financial concerns that may come up and arise as we adjust and figure out what is all happening with COVID-19. And with all these things coming up, it raises emotions for our parents, emotions for our children, emotions that everyone has to understand, identify, cope with, and be able to move through. As Sandy mentioned, we also have COVID-19 and then the injustices that are happening around the world that we're also kind of seeing here in Bermuda as well, which is the racism. So Bermudians, mainly Black Bermudians, are specifically trying to manage the emotions as it relates to these injustices towards them and the trauma of the racism that they have been experiencing. And with that, they are highlighting what's occurring in the U.S., and Black Bermudians are also faced with the need to manage these emotions while explaining and empowering their Black Bermudian children, despite of all the injustices that they're facing. So that's just, I want to say, the tip of the iceberg of what we're dealing with when it comes to the mental health challenges for our children, adolescents, and our families.
Thank you, Rishee. And now on to adult mental health matters. We have Gemma here.
Thank you. Yes, Sandy, we're noticing a huge spike in referrals in the private sector. And I guess that's partly because, actually there is a lot of heightened stress at the moment, a lot of challenges in terms of adapting to changing circumstances, uncertainty, I guess, for the majority of time we're thinking about this as a normal response to an abnormal situation. And for many people, it's kind of common for people to be experiencing some sort of difficulties in adapting. One of the areas, I guess, that we are seeing a lot more of is anxiety, problems with anxiety. And I guess that's partly related to our threat system being activated. Obviously, this is COVID-19 is a obvious stressor for people, and what we're noticing is that people's threat system is activated, but which is a healthy thing. We understand that that's an important part of being human. But what happens when that threat system is activated for any protracted period of time or with any intensity is that people are struggling to manage that on a day-to-day basis. I also feel like the number of changes that people are experiencing is often also linked to isolation and depression. And so we're seeing an increase in that. I mean, I think for people that are out there in the public right now thinking about how to manage their mental health, it's really about recognizing, if you can, the normal sort of response to this abnormal situation, but sort of thinking about a couple of things to think about is the intensity and the frequency of symptoms. So if people out there listening feel like they're noticing that they are more preoccupied with their worries, there's more rumination, if they feel like there's an impact on their daily living, maybe sleep is affected, maybe they're noticing a lot more changes in mood, I guess social withdrawal, and then if they're resorting to any unhealthy coping strategies like substance use or shopping or things like that, excessive things that maybe have consequences later down the line, they might be reasons to sort of think about whether extra help might be needed.
Thank you, Gemma. And with that, of course, with adults, they're in relationships. And so we've got Tawanna here to talk about both carers of individuals with COVID-19 and couples. So Tawanna, if you can share some trends that you're seeing in these important areas, please.
Sure. Before I get into some of the trends for couples, Sandy, I wonder if I could speak about some of the trends that we're seeing in the hospital setting as it relates to mental health. Particularly, we've seen an increase in our helpline number calls. For example, in March, we saw 77 calls to our general helpline number, and by May, we are receiving about 126 calls. We are seeing a similar trend with our suicide crisis line, where in March we saw no one calling, and by May we received 5 calls. So that trend is quite interesting. The other trend that we are seeing is an increase in risk assessments for children and adolescents, and that's particularly the case in the last 3 weeks. Interestingly, we have seen a reduction in the number of admissions to our inpatient services. However, we are seeing an increase in the number of new admissions, and that's primarily for people who have not had contact with mental health services previously. And this increase tends to be related to COVID-19 itself, relationship issues, persons dealing with lack of income, and some uncertainty around what will happen as a result of COVID-19. On the healthy side of the trends that we're seeing, there are 3 things I would like to mention. One, we've seen an increase in compliance with persons taking their medication. In addition, we've seen an increase in the compliance with persons following up on their appointments. And for those clients who have autism and other intellectual disabilities, we are seeing that they are quite enjoying the social distancing. And so shelter in place has worked very, very well for them. So these are some of the things that we're seeing in the hospital setting in particular.
Thank you, Tawanna. If you can actually also share, are there any specific trends when it comes to relationships with adults?
Yes, Sandy. We are seeing, as I mentioned, because we are seeing an increase in some of our admissions, and some of that is related to relationship issues, we are seeing that couples are having some challenges interacting with each other and spending a lot of time with each other. And it doesn't matter the kind of couple, and I say the kind of couple because we have senior couples, i.e. people who have been in relationships for 20, 30, sometimes 50 years. We have persons who are newlywed and just entering into relationships. We have people within our LGBTQ plus community who are also navigating their relationships and being in the same household more often than not. And then we have people who I call a little bit seasoned, meaning they are married for a little bit longer than about 5 or so years, but they are also having to learn things about each other in a home setting. And of course, later on, we'll get into some advice that we have for some of our couples as a result. For our carers, we are seeing that they are challenged trying to balance caring for a loved one that has COVID-19. And they have their own anxieties and they really want to be there. And there's a lot of fear and worry around what will happen to my loved one. And so again, we have some great advice for those persons during our broadcast this evening.
Thank you so much, Tawanna. I mean, there's certainly a lot to digest here. And one really important area that doesn't get talked about enough is often addictions, because they are often become individual secrets or family secrets. And so I'm so pleased that Cherita is here to talk about, individuals who are going through challenges with addictions and substance use.
Thank you. Definitely within addiction treatment, we've seen some changes in the way services are provided during this time, but each service remains committed to providing the best that they can for our clients. And I have to take this moment to commend our Turning Point clinicians for their ability to strive to meet our clients' needs and conduct telephone sessions so that we can continue to provide these services. Within Turning Point specifically, we've seen an increase in referrals to our service and people requesting treatment services, particularly within our detoxification and medical assisted services. And it's really interesting when we look at why this might be. For some, it may be that this period of being at home has made people more aware of their substance use, or they may have identified some worrying trends in their substance use. And for others, it may be that due to our borders being closed, we actually don't have incoming illicit substances. And so people may be experiencing withdrawal symptoms in that context of not being able to access the substances they would normally use. And so we're looking at these two factors as being reasons why we're seeing this increase in requests for services.
Thank you, Cherita. And then another major topic, as so many people have been working from home, is employer-employee relations, and where is the balance between working from home and maybe one's personal life? And so we're going to give that question to Aria Bean.
Thank you very much, Sandy. So what we've recognized at EAP Bermuda is that the work-life balance is more blurred than it has ever been before due to the COVID pandemic. So for those of us who have the opportunity to work remotely, we're trying to negotiate how to be good employees, how to be good persons in the home, how to be good parents, good spouses, how to be good partners, how to be good caregivers for any additional persons that we may have in the home, a whole host of things. Some of us are easily wearing 3 to 4 different hats on a daily basis, and each of those hats comes with its own set of pressures. So at this point, we are finding that there are some organizations who are responding beautifully to this process and are responsible and caring with their employees. But there are others who are still expecting the same level of output from people as if their normal life isn't happening or if it isn't as important. And that's where we see organizations and their employees starting to really struggle in their relationships. So a bit later on, we'll start to talk about what those red flags look like, as well as the coping skills for those employee-employer relationships.
Perfect. Thank you, Aria. And so with that, actually, what we're going to do is just go back around to each panelist and talk about what are some of the everyday coping skills that our listening audience can take on. Again, whether you are an individual or as part of your relationships or as a family unit. And so we're going to begin with Rishee again to talk about everyday coping skills for families.
Everyday coping skills for families, I would say, starts with the parents. So when it comes to that, be sure to give yourself some grace and mercy. Drop and change expectations. Like Aria voiced, you're holding so many hats in your hand. So to also have the same expectation that you're able to give the same output as you would as if you did prior to COVID-19 may not be as realistic, and that's okay. Give yourself some grace. Also take some personal time, manage, process, and deal with the emotions that arise by engaging in some self-care strategies and taking yourself to feed into your mental needs, your physical needs, your spiritual needs, your social needs. Take the time to make sure that all those pieces of yourself are being filled. In addition, limit media contact. There's a lot going on, there's a lot of information out there, there's a lot that may be adding to the emotional weariness that you may be feeling. So feel free to take a break. It's okay. And lastly, you can't take care of others until you first take care of yourself. So parents, please take care of yourself. For self-care from parents to your children. Again, with all that's happening in the world on our island, take time out to let your child know that you love them. Take time out to hear what's going on in their lives, hear about their emotions. Actively listen to how they're doing, actively listen to how they're feeling. Do your best to manage your child's environment by setting clear expectations and a daily routine, and manage your expectations for them as well. They're also going through this. They're also adjusting and trying to understand. Lastly, remember that they are emotionally impacted by all this that's going on, and you are their number one role model. So how you cope, deal, and process definitely sets a trend as to how they can then cope, deal, and process with emotions as well. And lastly, for my kids, what you can do is engage in activities that make you happy. Coping for kids is mainly giving them the ability to slow down enough to clear their cognitive processing. So engage them in coloring activities, outside walks or games. I'm sure they'll love it. Journaling and art is also a great way to get those emotions out. And also you can use some deep breathing and mindfulness activities as well.
Thank you, Rishee, for those fabulous tips for parents and children. And then to hone in even more on, as adults, what does that self-care look like? We're going to turn to Gemma again.
I think Rishee's list was great for adults too. I think that was a great list of fun things to do. I mean, I would add to that I think, as I spoke about before, that one of the things that happens with the threat system is that when you've got that threat system activated, it can be really difficult to bring your central nervous system down and come to a more baseline level. And so it's really important at the moment that people that are suffering with stress and anxiety or depression are investing in activities that put them in a different state, in a different emotional state. So that might be doing adult colouring or singing or dancing or doing something that brings joy. But it might also be really making the time for journaling, maybe about difficult feelings that are going on, talking to people about your feelings, normalizing and being compassionate to yourself and your family, just as Rishee said, about what's going on right now and how difficult that can be. And I think it's difficult to capture just the breadth of what everyone is experiencing. So, for a lot of people, it really is a challenge about adapting to change and being creative and resilient. So I think doing a sort of review of what is in your toolkit of resilience and thinking about how you can add to that in some way, whether there's any areas of your toolkit that are weaker, or where things are working for you and where you can build on that. I understand that, for some people there will be a lot of uncertainty about the future and a lot of anxiety about what might be laying ahead for them. And I think, for them, I would advise you to sort of focus on what's in your control right now. There will be a lot of things for people at the moment that are not in their control. There's a lot of uncertainty. So really focusing on what you can do and what is in your control, what you're capable of managing right now, and investing your energy there.
Thank you, Gemma. And what a great reminder that just because we think that these are really great things for our kids to do to cope, we can do the same things to bring us joy and remember what is within our control and not. So thank you for that. And so with that, I'd like to go to Tawanna to add some tips as well.
Sure. I'd like to add some tips for our couples and some tips for our carers if I can. First of all, with couples, schedule quality time together. Have fun, laugh, and be creative. Go on a date with each other. And when I say be creative, there really are, Bermuda is a very beautiful place, and there are just being outdoors and taking advantage of the outside to nurture each other in your relationship is really quite positive. choose your battles with your loved one, with your spouse, because you can't argue about everything. And maybe the dishes need to stay in the sink for an extra night. Maybe the socks need to remain on the floor. Or maybe the hairbrush needs to be, or the makeup on the bathroom sink. That's okay. It's not gonna break your relationship, and it's okay to choose your battles. I also think that couples really should have a sacred space, and that's a space where you don't argue with each other. Ideally, it would be helpful if that sacred space is your bedroom, but it doesn't have to be. So that means that if you are really, there's a lot of tension in the household, take that time, go to your bedroom. Don't use it as a place to argue. Don't use it as a place to be mad with each other, and nurture each other in that sacred space. And of course, the thing that might be a little bit taboo for people to talk about, but I'm going to raise it, is be realistic about sex and sexual intimacy. Because at this time during COVID, we may have challenges. We may not wish to be sexually intimate. And we really have to remember that there are many different forms of intimacy. Sexual intimacy is only one form. For example, one of the things that we normally ask couples to do when we are assisting them with some of the issues that they may face is we encourage them to look in each other's eyes. Just spend time looking in your loved one's eyes, because that really does, and that silence helps you to see into their soul. You can see the hurt, you can see the pain, but you can also see the happiness, the love, and the care that you have for each other. I want to also highlight for those of us who love to follow research that I was reading some research the other day, and it gave some very positive news. It said that 6 in 10 couples reported that COVID-19 had actually strengthened their relationship. And I think that's a real positive thing to remember. Now, with respect to our carers, if you're caring for someone who's diagnosed with a condition such as depression or anxiety, be patient with them, be kind, and remember that talking is only one form of communication. If you're caring for someone with COVID, spend only short intervals of time with them and use signals to indicate whether they are safe. You may read to them or talk to them because your voice may be very soothing as they're going through a very anxious time. Be kind to yourself and don't dwell on mistakes that you make. We are all human. And I think I heard other panelists talk about focusing on self-care. Make sure you get lots of rest and surround yourself with positive people all the time to strengthen you and your role in caring. I'd also like to talk a little bit about our resources, but I'll come back to that, Sandy, if I can, a little bit later. Thanks.
Yes, thank you, Tawanna. I think that the tip about having a sacred space in our homes where we're not allowed to dwell on mistakes or argue with ourselves even or others is such a beautiful thing to have, and it certainly feels like a must right now. And whether that is inside the home on your porch or in the garden or somewhere sort of that you can get to easily is such a wonderful tip in addition to all the others. Thank you, Tawanna. And now to Cherita, any tips that you want to share with our audience, please?
Well, Sandy, I think right now when we're looking at substance use, our keywords are mindfulness and awareness. And really, all of the things that have been talked about already as stressors, whether it's financial stress, relationship stress, being working at home and looking after your kids and homeschooling, all of these things are creating stresses for us right now. And we need to be aware of how we're coping. Are we coping by using substances, whether that's illicit substances, alcohol, tobacco? For many of us, just the fact that we're stuck at home right now, we may have noticed that we're using alcohol more, or we may be smoking more, or we may be indulging in illicit substances more. And so we need to be aware of why we're doing these things. And many of the coping strategies listed can be really helpful, whether it's engaging in some self-care activities, going for a walk, engaging in family activities, fun activities, connecting with family and friends, or even reaching out to a support group, which we'll talk about in just a few minutes. I think one thing to really keep in mind right now is that we need to look at moderation within our substance use, particularly if people are noticing they're using more or even using to the same level they may have been using before COVID, if they've had a break, is that people may be at risk of overdose. And then we're looking at a medical emergency. And so we really need to be mindful of, if we're in the midst of a medical emergency, to please reach out and get that help via 911 or going to the emergency room.
Absolutely. Thank you, Cherita. Yeah, those reminders to be self-aware, to be mindful, bring yourself into the present moment so that you know what's going on with you. And the moderation piece is huge. I think food, with everything that families are experiencing right now. So thank you. And so Aria, some tips, please, if you will.
Absolutely. So at EAP, what we would encourage our organizations to acknowledge is that their employees can only do so much. You are one person, a part of one organization, and a part of one household. And for those whose lives may be a little bit more complex, you may be a part of two organizations and two households. So understanding this, it's helpful for those organizations to make allowances in their employees' work schedules or permission to exercise flexi time, so that they can still be efficient parents, devoted caregivers, loving partners, and conscious individuals while meeting the ongoing demands of the workplace. Organizations should acknowledge that navigating through a global pandemic and discovering a new normal is a process that requires time. Also, that this process will bring about a lot of untapped emotions for people. So when you observe someone that you employ who's struggling, feel free to acknowledge them. Have a conversation with them, talk about things with them, check in with them, see how they're feeling. And then refer them to EAP as a resource so that we can support them in managing not only their emotions, but the time that they are spending working for you as well. Thank you, Sandy.
Okay, thank you so much, Aria, for those wonderful reminders of how we as employees and employers should be taking care of each other. And so now one of our final questions for the panelists is, so how do we know when to reach out for help and where do we reach out to? And we'll just have each panelist share a little bit about the organizations that they represent today. So we'll start with Rishee.
So for our parents, if you're noticing that your young person is not functioning as they usually do in the day, if they're seeming more stressed, if they're seeming more lethargic, if just something does not feel quite right, that can be an opportunity for you to reach out. In addition, for yourself, if you're finding that managing behaviors and managing emotions are becoming increasingly hard for you or overwhelming, that is also an opportunity where you can reach out to other resources. Prior to reaching out to specific agencies, there are also some practical resources that you can utilize within our World Wide Web. So you can reach out to centervention.com. They have free resources on social emotional learning for your young person. Also, Plant, Love, Grow. They have great resources and worksheets for the use of anger, anxiety, connecting in community, feelings, and decision making. Lastly, we all love a YouTube. So there's several things on YouTube that you can utilize to manage and begin utilizing mindfulness and deep breathing. If you've tried those things and still things are not working, it's still overwhelming, feel free to reach out. If you're having concerns related to child protection, feel free to reach out to the Department of Child and Family Services. If things aren't that heavy, but they're still heavy a little bit, feel free to reach out to us at the Family Center. You can reach us at 232-1116. Feel free to leave a message just letting them know that you're interested in services and you would like to have a screening conducted. And you can also email us at info@tfc, like the familycenter.bm.
Thank you so much, Rishee. And Gemma, anything that you want to share with the audience?
Thank you, Sandy. Yeah, I mean, I guess I would reiterate that sense of when to step it up is when you notice there's a significant change in frequency or intensity of those emotions. So perhaps you're more preoccupied, the emotion is more intense. You or others may be noticing quite a change in how you're regulating emotions. When there's an impact on daily functioning, so maybe there's a reduction in self-care, there may be disruptions in appetite, motivation, enjoyment of things, sleep, and maybe social withdrawal. And then there's coping strategies that you're using, maybe if they're more risky than usual, maybe more excessive, things like substance use, as we've talked about, maybe increased patterns of avoidance, maybe even self-harm or suicidal thoughts. That's definitely the time to reach out. Just as Rishee said, I guess there is a kind of staged approach to this. It's about gradually upping your coping strategies and doing what you can. And if you really get to the point where that still isn't really helping, then it's definitely time to reach out. And what's great about coming to see a therapist privately is you can talk about how you expand your coping strategies, how you look at your resilience, and they can help you with that in lots of ways. So I represent Solstice, which is a private therapy organisation that has lots of psychologists and different counsellors there. Their number is 292-3456, and you can email them at info@solstice.bm. There's also plenty of other organisations that have psychologists across Bermuda, and they're probably easy to find on the internet. And the other thing I just wanted to represent, that we do have the government mental health helpline, which is open 9 a.m. till 9 p.m. at the moment, and they have a range of qualified counsellors, social workers, psychologists available to talk to for free to talk through your problems. So that's a great resource that's available at the moment. And obviously there is the MWI crisis line as well, which is a 24-hour crisis line.
Yeah, no, that's okay, Gemma. We've actually...
So I need to give the numbers.
It's a great segue. That's a great segue, actually, to Tawanna.
No, we were doing it going, oh.
So that's a great segue to Tawanna. Tawanna, if you can share with us some of the things to look out for and the resources at Mid-Atlantic Wellness Institute.
Absolutely. I'd like to invite the listening audience to actually grab a pen and paper, because I'm about to give a list of telephone numbers. And while I'm allowing the audience to do that, let me just share with you what the examples of the resources that are available that you'll be calling if you call MWI. So first, in our children's services, they've been offering some weekly support to some of our local schools, including our two public high schools, as well as Purvis and Victor Scott, and that's really to reduce anxiety and stress. And they'll be rolling out that service as well to Dame Aria Bean Hope Academy. Our rehab team has been supporting the government's emergency shelter as well as the quarantine facility, and they've been administering and delivering medication in the community for those who require it. We also have a phlebotomist who's been working with our community teams, actually going into the community and drawing blood to support monitoring of medication that people may be taking. And for our community acute services, they've been following up with persons who need that help via telehealth. In our intellectual disability service, for those who may require respite care, they have the day center, New Dimensions, which have been going into the actual group homes, and we have 13 group homes in the community that we service. And we've really been helping those who have intellectual disabilities to learn some skills such as meal preparation. We've also been using a model called Social Stories, which allow us to explain to this population what does it mean to socially distance as a result of COVID, what do all of the rules mean for them. So now that you've grabbed your pen and paper, here are some numbers. If you feel unable to cope, seek help. We are here to support you. So the MWI crisis line number is 249-3370. After hours, you can call 249-3258. The suicide crisis line number is 239-1111. And of course, there are a number of private psychologists, social workers, and counselors in the community. And I would say, if you are going to see them, please make sure that you are going to see someone who is actually registered. There is also the Bermuda Government Emotional Wellness Line, which operates from 9 a.m. to 9 p.m., and that number is 543-1111. Thank you.
Thank you, Tawanna. I bet there was a lot of writing going on. And so, Cherita.
So indeed, if our viewers are worried about their substance consumption and worried that they might be using substances as a coping strategy, you can definitely reach out to Turning Point. And so our telephone number is 239-2038. And upon calling, you'll be connected with a counselor who will speak with you about the options, about what your concerns are. And if you decide to follow through with formal treatment, you'll be given follow-up appointments to commence that service. However, some of our viewers may not feel that a service like Turning Point is right for them. And then there are many community support groups that are still running, and our local recovery groups have done a really great job of turning these into online formats. And so if you go to their website, so for Alcoholics Anonymous, it's aa.bm, and for Narcotics Anonymous, nabermuda.org, and they have a full list of all of their meetings that are now on online platforms. And so that can be a really great way and an effective way for individuals to get recovery support at this time.
Thank you, Cherita. And we'll end with Aria on this question in terms of EAP Bermuda as a resource, and any red flags there that we should be looking out for as employers or employees.
Absolutely, Sandy. Thank you so much. So what we will say at EAP are the red flags is if you are having trouble with your employer-employee relationship, symptoms of that may be increased frustration with work-related tasks, also dealing with overall work-related stress, a decrease in motivation to actually get up and go to those Zoom meetings or make contact with your supervisors, or just be physically present and focused on what it is that you need to do in a work environment. So reaching out to EAP Bermuda, if those are some of the things that you are experiencing, is a simple one-step process. So you can give us a call at 292-9000, or you can email us at info@eap.bm. And our office manager will be happy to set up an appointment with one of our counselors for those persons who are with our member companies. What we also have is some additional resources for the audience. EAP is facilitating Wellness Wednesday webinars under the sponsorship of Argus Bermuda, and they occur each Wednesday for the month of June from 12 until 1 p.m. We just completed one today on budgeting basics. Next week, which is June 10th, we're going to be looking at navigating change with emotional intelligence. The following week, we will discuss couples dynamics. And for the final Wednesday in June, our topic will be parent-child dynamics. In addition to that, next month, for the month of July, we will roll out a new series called Ask the Expert. With this series, participants will have one-to-one contact, Q&A style, with various professionals throughout a variety of fields. So in response to those people who are not with EAP member companies, feel free to sign up for our webinars or our Ask the Expert series. It's definitely going to be important to make sure that you're getting great information to help you navigate during this time. Sandy?
Fantastic, thank you. So we're just going to end with one last question, and that is to each panelist. If they could say one thing to the listening audience tonight, what would that be? So we'll start with Rishee again.
First, Sandy, I'd really like to thank you so much for this opportunity to be on this panel today. What I'd like to leave with my audience is each one of us were born with power, privilege, and oppression. How we experience each of these characteristics is based on how we decide to use them. As a community, as an island, as a family, I challenge each one of us to use our power to empower, our privilege to unite and uplift, so that we decrease and take hold of the oppressions around us. Thank you.
Thank you, Rishee. And so, Gemma, any last thought?
Yes, thank you, Sandy, and thank you again for having me on the panel today. Yes, my last thought is just actually a quote, which is from James Dean, which is, "I can't change the direction of the wind, but I can adjust the sails." And I think that really does capture how much we are digging deep in terms of our resilience right now, to think about what is in our control, what are we capable of during these difficult times.
Thank you, Gemma. And Tawanna.
Thank you, Sandy. Before I give my final statement, I wonder if you'll indulge me one more time this evening. And I'd say this: if you are passionate about helping others, mental health care needs you, please, please, please check our website for jobs. If you wish to help financially support mental health, please consider giving to the Bermuda Hospital's Charitable Foundation. And to our staff at MWI, I really want to say thank you, because you have come in to care for our most vulnerable populations, even when sometimes you have been anxious yourselves, and we really appreciate you being on the front lines. And finally, to our listening audience, I say, mental health is about moments of joy. Look for those moments in every action that you have and cherish them. Thank you for having me.
Thank you, Tawanna. Any last thoughts, Cherita?
So my take home, what I hope viewers take away from this experience, is that if you are concerned about your own use of substances or family members' use of substances, please reach out for support. There is effective and confidential help available, and we hold no judgments, and it's there for you to utilize. Thank you.
Thank you. And Aria, last thoughts, please.
Yes, Sandy, again, being the last person to speak this evening, thank you so much for allowing me to be a part of the panel this evening. And it has been a truly awakening experience, as I've gotten just as much information as I'm sure the audience has. So what I'd like to leave the audience with this evening is a statement that will hopefully incite a change in mindset during this pandemic. We are not working from home, we are at home working. The best thing that organizations can do for their employees is, number one, recognize that they are human. And number two, to give them access to information that helps them grow and develop through resources and agencies like EAP. As we're all looking to create a better work-life balance, that is something that can be explored from a personal standpoint and an organizational standpoint, because at the end of the day, a happier, emotionally healthier employee is a better employee, and that leads to a happier and healthier employer. Thank you.
Thank you. So I want to thank all of our panelists tonight for sharing their expertise with us. And I'd like to remind the audience that you are not alone. Hopefully you heard something tonight that resonated with you, or a tip that you can now do, or something that reminded you why you may need to reach out for help. Despite the change and upheaval at this time, we can do things to help us to get through every day, to build resilience and to experience healing. If you need help, please reach out to these various agencies represented here today, and there will be a resource information sheet that will be posted on Family Center's website, www.tfc.bm, with more detailed information on how to contact all of us in case you didn't get that pen and paper fast enough for those phone numbers. We will also be hosting a watch party on our Family Center Facebook page where this discussion can be viewed again, and there will be time for a live question and answer session with all of these amazing panelists. We will advertise when that date will be on Family Center's website, Family Center's Facebook page, and our other social media forums. Please look out for that. Thank you for your time, Bermuda, and have a good night.